Hi, I'm Sherry, and today we'll be working with Maggie, who has had a stage 2 whiplash associated disorder about 3 days ago from a car accident. There's no neurological involvement, obviously. Her range of motion in assessment was limited to about 20 degrees, and there was fear with movement more than that. Swelling and bruising on the back of the neck and the top of the right shoulder. And then there was pain on palpation of her scalenes and SCM muscle. So today, the benefits of the treatment would be reduced swelling and reduced pain, and consequences of not receiving the treatment, of course. Things may stay the same. Things may get better on their own. And alternatively, you can see a physiotherapist, a chiropractor, acupuncturist to help you with some of these symptoms as well. Contraindications today, I wouldn't work on Maggie if she had any broken or dislocated parts, or blurred vision, or numbness in the top of her shoulders. So for our treatment today, I would like to try some cool hydrotherapy. Not too cold. I don't want to get the muscles spasming any more than they already are, but to bring down the inflammation a little bit and reduce the swelling. I could do some lymphatic techniques to reduce the swelling as well and move the I could pump the lymph nodes and centers and move the fluid towards them. Of course, lymphatic centers are around your collarbone areas, so I would need special permission, signed consent to work in this area because it is considered a sensitive area. So if you're okay with that, I can get their sheet out and we can sign it. I'll use some really light techniques to try to reduce your pain, some stroking, fine vibrations, static contact, to try to calm down your nervous system and reduce some of the pain response. We can work on some diaphragmatic breathing, reduce your anxiety, try to bring some of that fear down. Can do some Golgi tendon organ techniques and some organ insertion techniques to try to reduce the spasming in your muscles. And perhaps some light neuromuscular techniques as well. I can use some neuromuscular techniques to also treat your arms. If you have some pain in your sides, I could work on that area too. I can work on your back as you lay on it. It's okay. I can get in there and do some work to relax your back a little bit and stop any muscle spasms you're having. So for today, I would like to have you supine on the table, which is face up. Do you have any problems laying in this position? If you do, we could raise the table a little bit, give you a bit of an incline. But I think that's the safest position for you today to keep your movement to a minimum. I will put extra pillowing around your head so that you feel safe and cradled, so that you don't feel like your head's going to move any more than you want it to. I'll keep checking in throughout to make sure that you're comfortable and safe. I'll only have to undrape your arms and shoulders for this treatment, so you can remove whatever clothing you're comfortable with, and I can work from that. Of course, you can stop or change the treatment at any time. And please let me know if you're uncomfortable at any time. This is your massage, and I want you to feel safe and secure. So our treatment today is going to be about 45 minutes. Going to work on the areas we talked about. Try and get you feeling a little more relaxed and reduce some of that pain and swelling for you. I would like you to come back in once a week for the next 6 weeks. And after 6 treatments, we can reassess and decide what we might do to further increase your function. If there's still a ways to go at that point. Treatment. This will get better. And, there will be less pain, and treatment will help. As we proceed with the treatments over the next 5 treatments after this one, I'm going to use more direct techniques as your pain decreases. Hopefully your fear of movement will decrease along with the pain, because it's understandable that it hurts to move, so you don't want to do it. So I will use a lot more direct techniques as that pain decreases, so that we can do some stretches, some neuromuscular techniques, get maybe some joint mobilizations, just to increase your movement and flexibility, and get you back to all your activities that you're used to doing. I'll also give you some home care exercises to work on in that time, and obviously within a pain-free range of motion. I don't want you to hurt yourself, but just to increase that functionality so that we can get you doing all of the things that you used to do without pain. That is our goal. So, do you have any questions for me today about our treatment, or any concerns about our treatment today or our treatments to come? And do I have your consent for treatment? Thank you.